Hello, everyone. My name is Krista Anatoli. I am CTeL's Executive Director. Thank you so much for joining us today for this Thursday, July 9th CTeL webinar. The webinar is titled Current Trends and the Responsible Use of AI in Clinical Settings, 2026 and Beyond. With us, we have Dr. Catherine Barrett, who has been spending most of her career and academic research focusing on the appropriate and responsible use of AI in clinical settings. And so we are grateful to have her with us today. I am going to let Catherine introduce herself and talk a little bit about the work she does, and we can just jump right into the presentation. Given the fact we started a little late, we just want to be mindful of time and still have time for question and answers. Catherine?
Oh, thank you so much for that introduction, Krista. Just to keep me on track, what time do I need to stop?
Why don't we go to 2:30, and then that gives us about 5 to 10 minutes worth of question and answer.
Okay.
So yes,
Okay. Okay. So we had about 15 minutes then. Okay. So I just wanted to get started with a little bit of my background. Krista very kindly elevated my stature. I'm not a doctor. Um, I do have a JD, and my background as an attorney by training. Really consultant focusing mainly on data privacy and security and cybersecurity. For the bulk of my career, I've been in consulting. Most recently worked with MITRE Corporation. Some of you may be familiar with that organization. And I've spent a decade really working with the intelligence community and also the Veterans Administration, the um, um, the hospital organization, the EHRs with the veterans, with the Veterans Administration. So I've been in and around the healthcare industry for a very long time. And today I really wanted to focus my remarks on, let me just share my screen. Just one second.
Oh, 1 second. I'll make you a host. Sorry about
Okay.
that.
Oh, that's okay. Let's see. Share screen. I am not able to share for some reason. Um,
Sorry. 1 second.
okay. While we wait for that, I really wanted to focus my remarks today on the observations that I've made in the almost 2 years that I've been writing and researching about um, the responsible use of AI, not only in a clinical setting, but across different industries. I recently published a book on AI governance with the American Bar Association. I'm currently writing a second one aimed at with the AI governance, specifically targeting physicians and the attorneys that uh, support our physician community. That should be due out in early 2027, also by the American Bar Association. So I've been studying and researching and writing about responsible use of AI and AI governance for almost 2 years now. Um, and if I can just don't seem to be able to share, but let me just send my deck, Krista, to you. Would that be okay?
yes, absolutely. Why don't you send it over to me and I will try to share. You
Okay,
can.
no worries. Okay, 1 second. Okay, it's on the way. Uh, so while we wait for that, just mindful of time, I'm just going to get started. The we're all probably aware that the American Medical Association did a survey in 2025 of nearly 1,700 doctors, and it came back that about 80% of physicians are already using some kind of AI tool in the practice of medicine. Typically, the top three areas they've seen the most heavy use is in the summaries of medical research, the creation of discharge instructions, and maybe the documentation of billing codes. Clearly, we know AI is being used in clinical practice by physicians and healthcare professionals. It's increasingly embedded, as we know, in EHRs, such as Epic and medical devices. But what kind of risks are these presenting to the organization, to the clinician, to the patient-doctor relationship? Some of those AI-related risks we can see things such as that are not unique, to hang on one second. I'm so sorry. I've got to go back to my slides on my deck. Let's see. Oh, there we go. Fantastic. Thank you, Krista.
Mhm. Is this the correct slide? Would you like me to go back to the first one, table of contents?
You are doing great. That is the correct slide. So we're probably all aware of many of these AI related risks now because we've seen them repeatedly. But as you can see in the first AI risks slide, cybersecurity, intellectual property infringement, environmental harm, labor displacement. We can go to the next one. Algorithmic bias, data privacy, lack of accountability, lack of transparency, and explainability. These are all somewhat familiar risks to us. So understanding that there is a growing trend to showcase a commitment to what's called responsible AI, that it's not just a one and done plug and play kind of technology. But as we see in slide 6, there is a renewed interest in what we call responsible AI, which is really developing a practice of using AI systems safely in a trustworthy, ethical, and legal manner. And there's a growing trend that we can see toward this kind of more, what I term a systems engineering approach to clinical AI use and management. And we see that kind of approach being embodied in global standards bodies such as the International Organization for Standards, ISO. We see this reflected in the NIST AI risk management framework. We also see this most recently, this more systematic approach in the Joint Commission's certification for healthcare organizations that meet what is the responsible use of AI in a clinical setting. They just announced this program. I'm sure some of you may already be aware of it in June of this year. So it's a very, very new program. But we do see this emerging trend toward responsible use of AI. We can go to the next slide. So this particular phrase stood out to me when I was researching the ISO AI management system. So there is this commitment to responsible AI, not as a one-time act, but as a sustained effort involving vigilance and adaptation. So that is really reflected, next slide, in the Joint Commission certification. Again, this is a comprehensive approach that the Joint Commission is using. They are trying to allow hospital organizations and hospital programs to certify that they've met a certain standard of patient safety and patient quality of care when integrating AI into their clinical setting. So what does that mean? The elements of responsible use of AI in healthcare are listed here. One of the ones that I've seen repeatedly, many, many, many articles written about, is AI policies and the governance structures. These are foundational as we know, to any kind of AI program or solution set that you're trying to introduce into your organization. If you don't have those policies and governance structures correctly drafted and carefully vetted by your general counsel, it's very unlikely that you're going to have the kind of return on investment in terms of clinical care for patients and return on investment in terms of dollar and cents that you're hoping to see in your organization. Moving on to the next one, those elements of responsible use that we see the hospital certification body looking at and trying to examine hospital organizations and hospital programs for, or healthcare programs for, are reflected in, and the spirit is taken from various ISO standards, the most recent in alignment with the AI management system that came out in 2023. This, and also you'll see almost all of these elements are also reflected in the NIST AI RMF that also came out in 2023. The main focus of this chart is to really show that the rigorous, all-encompassing nature of the Joint Commission's approach to certifying responsible use of AI in a hospital setting is also reflected at the global level and our national level with the NIST AI RMF. So the next slide, the responsible, this is the manifestation of those different elements. This is the AI development lifecycle. This is a systems engineering approach to having a rigorous, systematic, repeatable approach to integrating AI into your clinical environment. There is a focus on these 6 steps that take you from a place of brainstorming all the way through deployment and monitoring the systems. We can see that one of the areas in my research that I found not enough time and attention is spent on is really defining the problem. Specifically, what kind of breakdown in workflow and service or decision-making process is happening that is creating the problem? Is this even a problem that AI can solve, or is there a different solution? How are you going to measure success from solving this problem? How do you measure success? And, what are the legal and regulatory constraints that really are identifying, that are identified with the problem and the solution set? Their point of failure for a lot of AI clinical implementation comes between number 1 and number 5. 1, not thinking through and defining the problem adequately, and 5, with the pilot, not carefully understanding how an AI solution may or may not fit into the clinical workflow, which causes a tremendous amount of issues down the line and possible failure. If we want to move on, just in the interest of time, the Mayo Clinic is one of the, obviously, it's an international, globally recognized, hospital system. It sets the standard of care, sets the patient safety and standards of care for the industry. They have back in 2019 started a very deliberate systems engineering approach to incorporating AI into their practice. They came up with a 10-year plan for how to do that, not only in just the United States, but internationally. It is really taking those elements that we saw in the Joint Commission and also in ISO and the NIST RMF, AI RMF, and putting that into a 4-phased approach to responsible AI development and deployment. This slide is really to illustrate how carefully they have thought through that process. For example, in phase one, it really aligns with the AI development lifecycle number one, which is all about defining the problem and the plan. Phase two aligns with the AI development lifecycle around numbers 2 and 3, which is the design of AI systems and the engineering of the AI solution. 3 encapsulates numbers 4 and 5 of the AI development lifecycle around assessing the AI solution and piloting the solution. And phase 5 is really the impact or the deploy and monitor phase, which aligns with number 6 of the AI solution, or the AI lifecycle. So this is one of the more prominent organizations. It's not the only one that has grasped this growing trend and really institutionalized it in a systematic, repeatable way throughout their organization. In practice, we can move on to lessons learned. In practice, NYU's Langone Health Center is an example of where they've institutionalized the AI development lifecycle, and their approach has resulted in some lessons learned. And the head of applied AI at Langone shared some of these lessons learned. I haven't put them all down, but I did want to capture some of the ones that really I've seen repeatedly in my research. Again, defining the problem. Organizations need to understand really what it is that they're trying to solve and whether or not AI is that best solution. Designing the AI system, even for the best performing model, you don't create value. And if it's not integrated into clinical workflow, if the physician or the healthcare provider has to stop and move from one system to another, for example, to care for the patient, that's not a well-designed solution set that's incorporated into the clinical workflow. Governance is repeatedly a place that needs a lot of attention. And governance is really a system-wide, much like risk management is a system-wide approach. Governance is also a system-wide approach. Everyone needs to be considered. It's a multidisciplinary game. It's not a single person player. And people management. A lot of times organizations think of AI solutions as an information technology issue. It's not. It's people, process, and technology. It touches everything across the firm. It creates numerous kinds of potential risks across the firm. And people management is definitely an area of lessons learned in Langone. Health systems shouldn't just be thinking about acquiring AI, but also how it impacts the people, how it can be trusted and incorporated into everyday decision making for the benefit of the doctor and the patient. So there was another issue that came up that I thought was important if we're thinking about return on investment for the organizations, and that is that one of the biggest drivers of productivity loss is not clearly defining the value proposition upfront. Oftentimes, there has been leaders within organizations that think about maybe the return on investment in terms of 5 or 6 different categories, but they don't think about the implications for active management of that system over time, active monitoring, and active response to whatever risks that humans in the loop and automated systems may catch. Legal implications of liability that could impact the organization's infrastructure, IT infrastructure, and training of people, for example, with the introduction of an AI solution. So you have to really be very clear, what is the problem that you're trying to solve, rather than just jumping to a conclusion or jumping to a solution that you think could be the conclusive solution. You really need to define your criteria for success and make it transparent to the organization's leadership, so that you get buy-off on what the problem is before you're trying to solve for the problem by looking at an AI solution. So there's been an increasing focus from boards of directors to leaders and clinicians for a repeatable and rigorous approach to incorporating AI solutions into a clinical environment. There is a growing need, and we see this repeatedly, for transparency regarding how healthcare organizations manage those AI-related risks to protect the patient, health and safety of their organization, and to also foster trust among both the users of AI and also the recipients of that AI solution, i.e., the patients. There's international and national standards bodies, ISO, NIST, and also, the Joint Commission in their certification program that they've launched in June of this year for a systems engineering rigor to demonstrate, responsible use of AI uh, and to showcase the importance of building trust within an organization um, that chooses to use AI in the clinical setting. I think those that wraps up my remarks for right now.
Well, thank you so much, Catherine. Wonderful presentation. And you really have identified an issue that we talked about last week at Nixon Peabody when we hosted our New York symposium, mostly focused on AI for a few invited guests. I think we had about 90 people that registered for that meeting. And one of the items that kept coming up is, what about AI governance? And Micah sat a little farther down from the table for me. And I think, Micah, you may have brought this up, or maybe another colleague, but we have multiple AI governances. Which AI governance do we focus on? And what if they're competing? Others at the table also echoed, the same concerns. And so I bring this question back to you, Catherine, is what happens when you have multiple organizations that are advocating for AI governance? Is there really any utility in it if there's not a sole source for it for the digital health community?
Well, I think, to answer that, I think I would look to the people who are regulating me. I'd look to the people who are setting the bar of what they consider to be patient excellence, patient care, patient safety and security. The fact that the Joint Commission came out in June of 2026 with this responsible use of AI in a clinical setting certification program speaks volumes to where the industry is going. As I illustrated in one of the slides, this is not a new concept. We see it in international standards bodies like ISO that have been out there for a while on showcasing what AI risk management looks like, what a systems engineering approach to AI clinical management might look like. The fact that you see it now reflected in the Joint Commission, that's what they're going to be looking for when they come to assess hospital systems and hospital programs. So it depends on who you are, but I wanted to show that regardless of who you are, the elements of responsible use of AI that we saw in the slide that I projected for the Joint Commission, those core areas really don't change. And really, AI aside from that, so we see those AI responsible use elements reflected in international standards for AI risk management and also the NIST AI RMF. Aside from that, we have to remember that governance as a concept, when we're talking about this kind of digital environment, we're really, really talking about data management and data governance. Those elements, whether you're talking about cybersecurity or whether you're talking about AI risk management or AI, responsible use, at the end of the day, the foundation of AI, the foundation of these algorithmic models, the lifeblood of them is data. So if you don't have your data management house in order, if you don't have a data governance program in order, and frankly, if it's not automated and looked after as a source of ongoing potential risk within your organization, benefits, yes, but also risks, then you're not prepared to introduce AI into your clinical setting. I've seen this repeatedly, no matter the industry, whether it's cybersecurity, the intelligence organizations, whether it's national security, when you're talking about a dead digital environment, especially with risk management, you must consider the importance and prioritization of data governance and data management. You have to know where your data is residing. You have to know which organizations are responsible for which data. Where are your data stewards? Where are your data owners? What are the intellectual property rights around that data? Who's responsible for incident management and response to data leaks or data breaches? Um, there's a tremendous amount of effort that, for example, I didn't put it in the slide, but Mayo Clinic has spent, um, they have spent 5 to 6 months as an organization focused just on data management and data governance before ever moving on to even defining the problem. So even before getting into the AI life cycle, um, AI development life cycle that I went over, my case study, Mayo Clinic spent 5 or 6 months just inventorying the data, being able to showcase the provenance of the data, understanding all their contractual organizations or the contracts in place for third-party data providers. It's a tremendous effort, but it's absolutely essential. So my answer to which governance, framework are you going to look at? If you are focused on those core areas that I've showcased, and also ISO does a great job of explaining more of the systems engineering approach to risk management and AI. Those are really the places to start, and really understanding, okay, no matter if you go ISO or you start with NIST, some of these same themes are going to be showcased across all of them. But if I had a limited budget and I had somebody telling me it was time to introduce AI into my clinical workflow or any other organization, I would immediately start with um, what does my current data management and data governance environment look like, and where does my future data management and data governance environment need to look like in order to support AI investment. And it's people, process, and technology. It's just not an IT thing.
And that's so important because when we think about AI is the buzzword right now, but it has the opportunity to do a lot of good for an organization to help simplify workflows, and it also has the opportunity to augment staff. But if done wrong, it can create a lot of risk and liability. And one of the things that we talked about at the June 25th meeting in New York at our Nixon Peabody Symposium is AI is just a blanket term, and there's a lot of risk and liability as it applies to the integration of healthcare. And healthcare is probably one of the most litigious areas that AI could be adopted in. And so you have to, if you are a health system executive or you are running a state-based hospital association and you're giving advice and guidance on AI adoption, or you are part of that vendor selection process, what would you advise if you are having to report to leadership that AI should be used or should be integrated, knowing all of the potential pitfalls that could happen?
Well, I think having looked through a lot of data from MIT and Stanford and AI researchers, basically, who have tried to provide best practices and guidance around, AI solution acquisition. I think the top three things that I would say is, number one, whatever kind of task force or committee or decision makers that are being brought together to identify what the problem is that we're trying to solve for, and maybe AI potential solutions, that team ought to be multidisciplinary. So it should include general counsel. It should include data scientists. It should include, leadership from the organization itself. It should include as many potential areas of discipline that the organization has before just marching off. So In other words, it's not just an IT solution, right? It's a multi-team approach to figuring out what the right AI solution might be. Um, we need data scientists, for example, to look at and evaluate how that AI model has been put together. Where is the underlying code source from? Is there transparency around it? Can the potential vendor explain what it is that we're looking at and how it operates? And what are the guardrails in place? So you really need a multidisciplinary approach because you need to know what the right questions are to ask. And those are not just all IT questions. There's legal questions to think through, there's financial questions to think through, there's, IT infrastructure and architecture issues to think through. So the number one thing I would say is you should bring together a multidisciplinary team to think through what the problem is, what the solutions possibly are, and what are the right questions to ask before you go off and start looking for anything. The second thing I would say is you should probably definitely have a list of what your principles, what are your AI principles? Are they reflected in a standards organization such as the Joint Commission or ISO or the World Health Organization? What are your AI core principles, like fairness, for example, like transparency, like equity? What are those? Because the third thing I would do is you need those in order to those AI principles in order to third thing, make sure that whatever potential AI solution provider that you're looking at shares those principles. You've got to start with the foundation of common, understanding of this is what we're looking for. These are the values that we have and we share. We don't want to be in business with an organization that doesn't share these. And of course, further down the line, after you've gotten your multidisciplinary team together and you've you've got your AI principles in order and you've got an idea of what vendor solutions share those or aligned with those AI principles, then you should definitely be doing an internal uh, deep dive into what is your current state of not only data governance and data management, but your architecture, your IT architecture, and also a review of your current contracts that are for any kind of third-party vendors, any kind of cloud service providers, for example. What are the terms of those contracts? Because your existing contracts for those services will play a role in understanding what your potential data-related liability are for for AI solutions that you bring into your network. So you really need to understand also what is your current state of your legal obligations, the terms and conditions under all of those contracts that you may have for third-party providers, third-party solution providers, because you're going to have to understand what that risk profile looks like before you start down the road of considering additional solution providers and bringing that into your environment.
I agree with you. And CTeL 3 years ago started the CTeL Blue Ribbon Collaborative. We recognized that AI was going to bring about some legal and regulatory questions that would be honestly quite analogous to the telehealth questions that the industry had to answer in the late 2008 to 2013 timeframe. And so CTeL started this Blue Ribbon Collaborative, and the goal was really to focus on research that would be backed, or policy and research that would be supported by those that created the technology or reviewed the technology in academic sense. And so as we're thinking about AI, should we also be thinking about future technology like quantum computing? Everything that we have been told and has been shared with us in other AI conversations is that AI is really the equivalent of a rotary dial phone in terms of technology. Like it works okay, but in 10 years, our kids are going to laugh at us that we thought that this was like groundbreaking and that we really should be head focused on quantum computing, which is also, by the way, another area that CTeL serves and is building out for our membership. What are your thoughts on that?
Well, that's an excellent place to go because it is the future of the digital world. My familiarity with quantum really goes back to my work in the intelligence organizations. Yeah, quantum is a significant, I would say, wearing the IC hat and, national security issue for the country. It's an issue for banking too. It's an issue for anybody who uses encryption to do anything, because essentially what quantum will do is eviscerate the trust, the confidentiality that we gain by having the ability to transact using encryption. So it'll break encryption. And that's why you see countries such as the United States and China really going after, right,
Mhm.
quantum computing. And whoever gets there first is going to win the big prize of being able to break encryption. And I just don't really want to wake up the morning that that happens because I think that it's a significant economic issue. Obviously, it's a huge national security issue, economic issue, societal issue. Uh, Honestly, with the world on fire in so many different areas, I haven't focused tremendously on what that impact would be to the hospital in the clinical setting, but obviously it would undermine any kind of privacy and confidentiality that you'd have in patient data. How do you protect it if you can't encrypt it? Uh, I don't know what we're going to do in that world. But I'm happy to hear. I'm happy to hear CTeL is got a growing practice in that area. But
The first
um,
and the only one telehealth organization that is focusing on that. So I want to do a little brag
that's
on my team.
great. That's
We
great.
Yeah, we started that a year ago, actually focusing on quantum.
Yeah, that's fantastic. And now the journalists are catching up to you, Krista. But yeah, it's the hottest new thing to worry us all and keep us up at night. But I don't know what the technological solution will be once quantum computing has the ability to break encryption.
Right. And so I think that brings us to the point we have some hospitals and health systems and a medical board on the line with us right now. And so what happens when cybersecurity and privacy teams on both the tech and legal side are working 24 hours a day once there is a major break. But those happen once in a while. They might happen once or twice a year. With quantum computing and potential bad actors, and with the increase in medical devices that are implanted in the human body, we anticipate that that could be a potential risk. And so what does that risk and liability look like, and how is it carried over to the hospital or health system or the vendor service provider that is planning to use that? It sounds like it's going to take on a whole mind of its own, and that's probably for different conversations since we are running out of time. We have about 5 minutes left. Do we have any questions from the audience? Micah, let's start with you.
Thanks for the presentation. I really appreciate some of the insights that you were listing out. Going back to the deployment conversation, we've certainly seen ways to not do it, and I totally support the multidisciplinary team approach that you suggested. However, our experience has been that that's not what happens, with respect to health systems in particular. And if we're talking health insurance companies, it gets even worse, because most of those groups, in my experience, don't have a data scientist on staff at all. And if we're following, say, EMR or telehealth platforms that were rolled out pretty rapidly during COVID, the end users, so to speak, with the clinicians were the last to see it. So I was wondering if you had any insights or suggestions on how that could be addressed, either through policy or statute or anything like that, that might help bend that curve towards the more multidisciplinary, responsible assessment approach.
Yeah, I appreciate that question. This is why consultants get hired is to come in and identify the problem. Just and be able to say, look, you guys are doing it all wrong and here's how you did it wrong. I think one of the beautiful things about what the heartening thing is to see an organization like New York City Langone Hospital System, or Mayo Clinic doing it right. Now, these are organizations that have resources. They have a lot of experience, I think, doing very complex, implementing very complex systems and changes within an international organization. They have a team-based approach that this isn't a foreign concept to them to have a multidisciplinary approach to something, and to have data scientists on board. This is not foreign. They've had uh, they've had this in place before the excitement and hype of AI. So they've been mining their internal proprietary data as an organization for a long time for patient safety, patient health, patient quality of care. So that practice is kind of already there. I think that's a great advantage that I've seen in organizations such as that, and frankly, the Kaiser Family Foundation, or the Kaiser Health is another example where this kind of institutional um, um, memory exists already for large, complex digital implementation that's also people process and technology oriented. Um, but to answer your question, so that's exciting to see that this exists somewhere. It's done well. Uh, there are lessons learned. I'm not saying that there aren't mistakes. There certainly are, but the fact that they take a very systematic approach to it, and the fact that they've done things before trying to do AI as an organization and have learned lessons from that, and then implemented them for AI in a clinical setting is heartening because it can be done. Uh, but to answer your question, it would really benefit us as an industry to have, sure, legislation, thoughtful, carefully drafted legislation that really emphasizes the importance of, foundational AI governance, um, a lot of due diligence around, your data management. Like I said, um, some of this has to be organized and has to be really vetted carefully, and it's painful because all of us have data legacy systems in place, right? And so to have to go through and really understand the origins of data and the intellectual property associated with data is really difficult for a lot of organizations, especially very complex organizations like healthcare settings where you've got all kinds of uh, you know contracts in place for all kinds of digital services, for example, and medical devices. So it's not easy to do. And thoughtful legislation would help, right? Maybe create some standards, standardization, maybe our, um, you know, uh, licensing boards that license physicians ought to be forward thinking about what does AI do for standards of care? How is it going to change? How should those be updated? Maybe um, 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 medical schools ought to incorporate, responsible use of AI in a clinical setting, and um, potential liability and personal responsibility for these kinds of activities, and have that included in they might already be, I don't know, but having that um, included in medical schools and nursing schools would seem like a no-brainer. But I think my I highlighted the Joint Commission in part because they are the largest certification body for patient safety and quality of care. It's an internationally recognized body. I live here in Portugal, and there are in Lisbon, and there are hospitals here, private hospitals that are certified by the Joint Commission. So I highlighted them because they really are global in nature. They
Mm.
are reflecting on their certification. They are reflecting the ISO standards of care around, I'm sorry, the ISO AI risk management, um, engineering approach. And I think before I'd count on legislation or regulation. I'd count on something like the Joint Commission being the forcing function behind the change that we've been talking about, like, or the adoption of responsible use of AI in a clinical setting.
Hmm. I mean, I can provide some feedback on that. So there's URAC, yeah, URAC, came out with the first accreditation standards for an AI tool, ranging from development to deployment. I think they're going to update that within the next couple of months for version 2.0. I'm with the Washington Medical Board, and so we actually introduced our draft policy on June 30th of this year for AI in clinical settings. And I know that with respect to at least University of Washington, they are addressing student use of AI. A lot of it is focused on you're not allowed to use it until you learn your basics, because there is a concern about what's being called never skilling, where they just rely on the tool, and if there's no internet or no power in a hospital, they wouldn't be able to function. So that's being done both at the medical student level as well as the resident level. The resident level, as I understand it, they're freeing them up a bit more. But it's one of those things where they have to be able to do whatever it is without the AI first, and then they can start to rely on it.
Well, I appreciate the information about the Washington Medical Board June 30th release, so I'll have to grab that and the URAC. The I think, we see this, we see a broader concern. I think you're touching on a specific example of a broader concern that is with AI, with the use of AI, you might have the loss of critical thinking skills, the ability to function really without
Mhm.
the use of that, right? I mean, in law school, this is one of the things they're grappling with. I'm part of the AI steering committee for the American Bar Association around, how should we be educating our future lawyers? And this is a really big issue. We don't want lawyers who are not able to think critically, and to be able to really function with all the skills that we go through the rigorous process of law school for, because we've outsourced that to AI. So I have seen the rise of this concern, the loss of critical thinking and what that could do to the profession. It's not a good idea to not have, to have potentially, people who are touching patients and all the risk that associates with that if you don't have the ability to perform your duties without AI assistance.
Thank you.
Thank you so
Thank
much.
you.
We're at time now. Thank you for everyone that um, Syra, you suggested that we send these slides out. We absolutely will. And yeah, everyone that registered for this event will have them in their inbox. They will also be available on the CTeL website. And we look forward to working with all of you in the future on AI. Just as an FYI, CTeL is going to be hosting an AI roundtable on July 15th. It was supposed to be in person, but due to a lot of travel schedules, we decided to transition it virtually. We have capacity for 75 people in that roundtable. We have about less than 10 seats available right now. So if you are interested, please register, and we welcome you to participate on July 15th. And you could do that by registering on the CTeL website. You could do that on our LinkedIn page, or if you received an email, you could just go straight to your email and register there. Thank you again, and we will see you next time. Take care.